All these people should be censured. I mean, that is disgraceful that they would say that, even with politics as it is today. Here exclusively, Acting Secretary of Department of Homeland Security, Kevin McAleenan. Mr. Secretary, thank you for being here. What is going on here? The accusations over the last 2 days that you have to endure this, that you are intentionally keeping kids in this precarious situation. We have some children who've died in custody.
It's a sad state of affairs in our politics when we've got an actual crisis, we've got solutions on the table, we've got clarity on what our men and women on the border need with the support from Congress, and yet that's the kind of thing we're hearing.
You needed X number of beds and facilities to house what you predicted months ago. We covered this. Right. You predicted that if we didn't get the money to house these people, would have kids basically on the floors and mats and whatever you could provide at Border Patrol facilities or in tents outside. Right. Did you get the beds?
No. No.
This is unbelievable.
This administration's put solutions on the table over the last 3 weeks, both to manage the crisis with beds. These are beds for children who are coming unaccompanied. It's our statutory responsibility. It's our human responsibility to take care of them. We asked for that funding. We've also put a solution that would end the crisis to begin with, allow us to detain families together through legal immigration proceedings.
So keep them at the, just so people understand, crossing the border, as I saw many family units crossing.
We're there.
Crossing the border, they would not be processed and released under your plan. They would be processed and they would be adjudicated at the border, correct?
They would see a judge. They would get a fair hearing. If they had an asylum claim and only about 10% due, they'd be allowed to stay. But the rest would be repatriated swiftly, and this flow would drop immediately.
Yeah, it would drop overnight, would it not?
It happened in 2014. We did the same thing then.
Well, right now we have recriminations in politics. So it's finger-pointing with the most heinous accusations being leveled at you. If you could get one thing, just one thing tonight, what would it be to solve this problem?
Just one thing tonight, I would change the law on the families so we could keep them in custody. That's 70% now of the crossings the last several days. We need to address that.
How many do you have in custody? Let's just go to the unaccompanied minors. That's babies all the way till 18 years of age, correct?
Yeah,
How many in your custody?
Most are 13 to 17-year-old teenage boys, right? We've got almost 2,000 in custody right now, about 1,800 in custody.
Where are they living?
They're staying in Border Patrol stations. These are police stations designed for adults.
How much does that cost? I mean, I was there.
Yeah.
They're not meant to hold people.
No, not at all. We're using a huge portion of our operating budget on care and feeding. We've got Border Patrol agents, 40% of our agents, who are supposed to be out on the border protecting people. That you've seen them out in the field. They're doing care, custody, transportation, hospital watch for unaccompanied children.
We saw this. I mean, we saw people arriving, jumping in the water, getting pulled up in the boat, falling out of the boat. I mean, we witnessed this. And HHS is supposed to pick them up after how long?
It's supposed to be within 72 hours we transfer to HHS.
And do they have anywhere to put these people?
They don't have any bed space.
Okay, so there's nowhere to put the people. Congress won't allocate the money.
Exactly.
And then you're the bad guy. Someone explain this situation to me. I mean, this is really ridiculous at this point.
It's hard to explain.
So right now, the president has decided, like, look, he can't work with these people. They're trying to impeach him. They're claiming he's doing a cover-up. So things look like they're stalled. What is this going to mean as the hot summer months kick in? It's already hot down there. It's getting worse. What do you expect to see?
Well, even though we've provided solutions to Congress, we're not going to just wait for them to act. I'm going on Monday to Guatemala. I want to take this fight to the cartels that are smuggling children, starting at the Guatemala-Honduran border. We're bringing HSI agents, CBP officers, Border Patrol agents to embed with the Guatemalan forces and try to interdict this flow at the beginning. We're working with the government of Mexico on the same thing, sharing intel on the people profiting from human misery. We can't allow that to go on anymore. And then the steps we're taking at the border. Try to get judges down there to adjudicate hearings more quickly, get people repatriated, and change this dynamic.
What about the story about the plan to send people around the country? That was blowing up the internet over the weekend. There was going to be 300,000 sent to Florida and something to California.
Sure.
And people from Florida were messaging me going, what are they doing sending them here? I'm like, nobody wants it, not in my backyard, scenario. But what was that?
So I understand Governor DeSantis' concern, Senator Rubio. These communities don't need an influx of migrants, right? Everybody's overloaded across the country with the numbers that you outlined at the open. So what we're doing is trying to manage that in the border environment, first and foremost. We have stations that are full in South Texas, in El Paso, in Yuma, Arizona. So we're transforming and moving migrants from stations that are overloaded moving them to San Diego, for instance, where we have more capacity, moving them to El Centro sector. That's how we're trying to manage this capacity issue. But we're not going to, we have no plans to move migrants to states like Florida or to the northern border at this point.
Mr. Secretary, I also want to get your response to this disturbing headline today. Infectious diseases, a rising threat among migrants at the southern border. I saw a lot of people coughing, bad coughs when I was there. A lot of children. I mean, again, the Border Patrol agents were donating their own children's clothes where I was and bringing in diapers and formula, buying it with their own money. It's like teachers buying school supplies here. How big of a concern, though, is the health risk, both to agents, to obviously the migrants themselves, and then the communities that are absorbing these people? It's
significant. I've been talking about it since December. We are seeing younger children arriving sicker every day. We had an H1N1 outbreak yesterday in McAllen Station. That's what the infectious disease that our teenager who passed away on Monday, it looks like he had the flu, a very virulent strain of the flu, H1N1. We've seen measles, we've seen mumps, we've had folks in ICE custody that are quarantined due to mumps. It's a tremendous challenge. We've got a huge medical effort underway with contract support, with Coast Guard, with the Public Health Service. But really, this is an overwhelming problem. And when smugglers are keeping people in close quarters in Mexico in stash houses for days on end, it just exacerbates.
Yeah, they just 120 people in the back of a truck last week, I think it was, 10 days ago, whatever that was. I mean, that in and of itself is horrific.
It's very dangerous. The temperature in that truck was 98 degrees.
We got a lot of folks on television who are turning this into a hysterical issue as far as blame. This was on MSNBC today.
Okay.
This is our responsibility as a country and as a nation. And we are not being given answers as to what is happening to small, young children, to teenagers, to girls, to boys who are being taken away from their families, from their parents, and left alone in our custody. Ivanka, Jared, anybody, get to him.
Reaction.
Well, first of all, that's not happening. We're separating children in maybe one case a day out of the 3,000 families arriving. It's very rare. It's for the safety of the child, first and foremost.
When it's not the family member with the child,
It's
correct?
a prosecution for a serious criminal offense. It's a threat to the child. It's a communicable disease, or it's someone who's presenting a family relationship that doesn't exist. That's when that happens. And the other thing on the health care, we are doing everything we can to take care of these children as they arrive. We've had over 150,000 kids enter our process in the last 3.5 months. Our Border Patrol agents are doing an amazing job to take care of them.
Do you think the new rule that was, I guess, released today, that sponsors of illegal immigrants in the United States, I guess, are going to have to guarantee they're going to pay for their health care and pay for their, other costs, which is a law right now. It's a law, but it's not being enforced. Is that a good idea? Would that perhaps bring down the illegal immigration?
I think a whole set of initiatives that we're pursuing, along with the Department of Justice, to tighten our enforcement of laws that haven't been enforced effectively in the past, to make it harder to be here unlawfully. I think those are important steps.
E-Verify, yes?
Absolutely. We support it. We're ready to expand it.
Mr. Secretary, these are going to be tough months. We're going to get back down to the border. Thank you so much.
Thank you for coming down and seeing our men and women.
Absolutely.